My name is Denny Ankenbrandt, and out of the 3 questions, I chose to do case study 2. And before we begin, case study 2 states that a 4-day-old infant, which in this case is referred to as patient A, is being followed in your clinic. Her birth weight was 5.9 pounds, and the pregnancy and birth were both normal. The results from newborn screening demonstrated a phenylalanine level of 6.6, and the normal is actually 1 to 2. A presumptive diagnosis of PKU, which is phenylketonuria, was made, and additional samples were obtained for further analysis. The parents deny a family history of PKU. And then it goes on to ask, as a consequence of this presentation, which amino acid may become essential. So PHE, dietary restriction therapy, was initiated at 14 days of age with good response of plasma PHE levels that dropped to within the normal range, which was 1.65. Then it asks, what are the potential cause or causes of the presentation of PKU? Then we have another infant, which is patient B, is also being evaluated for suspected PKU. And then it just says that BH4 loading tests are performed on both patients, and the results are presented, which is presented in a graph below. Tablets of the synthetic cofactors are dissolved in 20 milliliters of water in dim light and administered to the patients at least 30 minutes before a meal. Blood was drawn before and 4 and 8 hours after BH4 loading. pH levels are determined as follows. And then just ask, how would you summarize the results of this test for patient A as well as patient B? So for my first question, in case 2, I need to first explain what PKU is. PKU is a decently rare disorder which is inherited, causing the amino acid known as phenylalanine to build up in our body. This disorder is thought to be caused by a particular defect within the gene, which helps to create an enzyme that is used to break down phenylalanine. When we do not have this ability to process phenylalanine due to the lack of the enzyme within our bodies, typically dangerous levels become inevitable when an individual with this disorder eats foods that contain substances such as artificial sweeteners or proteins. And in this case, I'm assuming that this infant is not consuming artificial sweeteners, so more than likely it's due to the proteins that it's ingesting. So to answer my first part of the question, the amino acid that may become essential is tyrosine. This amino acid is somewhat conditionally essential, an essential amino acid for most patients presenting with PKU, because without PHE, the hydroxylase enzyme, tyrosine, cannot be made within the body via the breakdown of PHE. So lastly, when we look at the second question, the test results of patient A and patient B can be summarized through their results when administered BH4 and analyzing the levels of the PHE, whether they go up, down, stay the same. Because it is suggested that patient A does not produce PHE hydroxylase enzyme, the PHE hydroxylase enzyme, because the chart shows that there is a steady increase of PHE within the blood. The increase results from a lack of the hydroxylase, which would normally lower these levels in most circumstances, or in all circumstances, through hydroxylation. With the results from patient B, the chart shows their levels of PHE being managed, and in this particular case, declining, which would be suggesting that it would be being managed. This chart kind of suggests that patient B can produce the non-functional enzyme to manage these PHE levels, but with the help of the BH4, this PHE is managed and the enzyme becomes functional rather than non-functional, which is in the case of patient B. So for the second question, out of the three, I chose case 3, and the question states that a 47-year-old man presents with severe pain in his right great toe. He is unable to bear weight on his right foot, and there was no apparent trauma beforehand. He reports that the pain started last night and began to increase in severity throughout the night. Based on his physical exam and laboratory findings, he is diagnosed with gout. Gout can be caused by several different mechanisms, and blood samples. Several different mechanisms, and blood samples were then drawn and urinalysis were performed. The results from this individual are listed. So it also gives me a chart which states that the patient's plasma urate levels being much higher than normal, and the urinary uric acid levels were much lower than normal circumstances. They go on to ask, what is the best explanation for the presentation of gout in this individual? And please explain why the other choices are not consistent with the data that was given. And then what additional information you may have to decide the root cause. They also give the information that the patient tells myself that he recently switched his diet from a regular soda, or from diet soda, which he was drinking pretty consistently, to regular soda because he read that the fake sugar, quote unquote, diet soda was bad for him. He also goes on to tell me that he drinks between 4 to 5 liters of this soda a day. And then there's also a note that suggests that high fructose corn syrup is one of the main ingredients in these sodas. Then it asks just to distinguish which out of the three are probably the root cause of this gout. One is overproduction of purines, one is decreased salvage of purines, and another is decreased urinary excretion of uric acid. So for my second question, just a little bit of background information and about how gout is formed. So gout is known to be a disease which often results from deposition of urate crystals, which are formed from an overproduction of uric acid. As we can see in our chart here that I was previously given, the urinary uric acid levels are well under the normal levels, which suggests that the patient's body may not be getting rid of these levels quite normally or normal compared to other patients. The disease is often associated with these higher levels of serum uric acid levels, which again, looking at our chart that we were previously given, we see that the plasma urate levels are well above normal range. This patient is consuming much more higher fructose corn syrup because he did make that switch from diet soda to normal soda. And this is basically giving him a flood of these new purines within his body. So the syrup is eventually converted to purines, which hence the overproduction is one of the possible reasonings. Additionally, these purines are then converted to uric acid down the road, which may be a reason for these levels to spike in the patient's body and in the end could possibly be causing the gout. So for the three that I need to compare, overproduction of purines, it does have a decent effect on this patient developing gout. However, if the body is working properly as it should, the body should be excreting the purines out of the body through things such as urination. For the second one, decreased salvage of purines. A decrease in the salvage of purines does not fit this equation because the patient's levels show no reason to, quote unquote, need to salvage anything regarding purines. Additionally, a problem with salvaging purines is not a reason for developing gout. And then the last one, which is the answer that I chose, is decreased urinary excretion of uric acid. So this is one of the things that was showed in the chart that was significantly lower than a normal patient's levels of excretion. So this is likely the cause. As the body begins to build in these purines, which are eventually converted to uric acid, the body needs to be able to excrete these so that instances such as gout does not build. And this just increases the numbers that are within the body because the body cannot excrete them. So in the end, the chart shows a patient incapable of doing this, which is what I believe to be the primary cause of the gout.